If there is ever a time you need to advocate for yourself as a patient, it is certainly just after hearing the words, "You have cancer." Yet advocating yourself may be easier said than done, as chances are you may be scared, nervous, intimidated, and possibly needing to make big decisions about things you know little about. So how do you best advocate for yourself in these situations? We are discussing just that today in episode 14 of the Recovery Room podcast. You need to drive your train, advocating for yourself in healthcare. We are joined in this conversation by gynecological oncologist, Dr. Elizabeth Dickson. We will define the important terms, informed consent, and shared decision-making, and then discuss tips and tools to help make you more comfortable in being a better self-advocate. Thank you so much for joining me today. I truly appreciate you being here. I'm cancer physical therapist, Dr. Leslie Waltke. Please hang around until after the show to learn how you and I can engage directly in my awesome cancer survivor membership group called Recovery Room Plus. And remember, after the guest says goodbye, I'll do the all-important quick episode recap. As we get started, in the comments, please let me know your thoughts. Did you feel like you had the tools early on to be a good self-advocate in your cancer care, or was it a skill you would develop over time? If you have a story to tell, please leave it on our voicemail at 414-373-0700. This is the Recovery Room podcast, discussing all things cancer and cancer recovery. We bring you the experts, accuracy, understanding, and next steps you need to be healthier, more confident, make better decisions, and live your best life after cancer. Welcome, everyone, to the Recovery Room podcast. Today, we are talking about informed consent, shared decision-making, which may not sound like sexy words, but in a world where people/patients need to advocate for themselves and or for their loved ones, this is critically important. So I am excited to welcome to the show Dr. Elizabeth Dickson. Dr. Dickson is a gynecological oncologist and really takes to heart all of these terms and is a specialist in helping people advocate for themselves in healthcare. Because healthcare is freaking complex. Cancer is freaking complex. It happens often very fast. It's traumatic. It's scary. And then we're like, oh, you need to advocate for yourself. People are like, I'm just trying to get my shoes on the right feet, man, and get to the right place at the right time. I don't have time for all this baggage. So anyway, so what I want to just start with is I'm just going to read verbatim the National Cancer Institute, which is here in the United States, the definitions for informed consent and then shared decision-making, so people kind of have a better idea of what they are. Because for we in healthcare, those are like first grade terms. It's just they roll off our tongue on a daily basis. But for people that walk into the system, that just get hit over the head with a sledgehammer going, oh, by the way, you have cancer. Now you have to make all of these life-altering decisions in a very short period of time. And it's like, what? Right. So the National Cancer Institute defines informed consent as a process in which patients are given important information, including the possible risks and benefits about a medical procedure or treatment, genetic testing, or a clinical trial. This is to help them decide if they want to be treated, tested, or take part in the trial. Patients are also given any new information that might affect their decision to continue. The National Cancer Institute defines shared decision-making as, in medicine, it's a process in which both the patient and the healthcare professional or physician work together to decide the best plan of care for you/the patient or/your loved one. So I think has two parts to it. Consent, because again, people, you fill out the paperwork. It says, I'm giving you my consent for you to treat me. We can't, in healthcare, we can't do anything to you as a human without you saying, yes, I agree to this physical therapy technique, or yes, I agree to this surgery, or yes, I agree to this medication. So that's the consent part. But then there's the first word, the informed part. Right. So, and people are like, I don't care, just tell me what I'm supposed to do. And that is so normal. So if that's the way you got through it, don't make yourself feel bad, because there's something very human about that. But people really should be informed on what they're making decisions about, which for some people is very easy. Other people it's very, very difficult. So we'll talk about that. And then we'll talk a little bit today about when we talk about advocating for yourself or for a loved one, shared decision making. So this is probably a little bit more mainstream than just healthcare, but I know you're going to talk about talking and asking questions, and then talking about steps that people can take to build a collaborative relationship and how they do that. Because it's on paper, it looks easy, but it can be really, really hard. So start from the beginning. So talking and asking questions, how do people best get through this process, and how can they advocate for themselves in a very complicated situation?
And I think communication is the biggest thing with that, and making sure that those lines of communication are open, because we as physicians, we have one kind of goal-oriented thought process, treating your cancer, but we don't have all of the other goals that you might be wanting to talk about or advocate for. And so really letting us know and keeping that line of communication open is what really is important for kind of making sure that not only shared decision making, but also that you are aware of what's going to happen. So do we talk about, at the beginning when patients come into our office and it's their first meeting, they're not going to remember half of what I said, just because all they hear is cancer, and then the rest of it kind of goes out the window. And so at the end of that, can we go back over what the plan is? Can we go back over what your questions are? Can we answer, where you're coming from at this approach to this diagnosis? And making sure that when we're talking about a treatment plan, that you've been aware of all of the risks, the benefits, other things that we can do. And if you're not, making sure that line of communication is open so you can ask those questions. I think that really is the key, is making sure that you have an open line of communication. And then the other thing that I tell patients is, on that first visit, come with someone. Or if they can't come with you, have them on the phone. There is no problem putting someone on the phone, on speaker, making sure that they can be, that, the physician can hear them and they can hear the physician, but making sure somebody else is in the room with you. And some patients say, well, I don't have anybody. Well, then let us know that. And what we can do is, there are people in the cancer team called cancer nurse navigators who can be in there with you, who can help you advocate for yourself if you don't have anybody that you think you can lean on. Because you need somebody really with you on that first visit to kind of get down or jot down things. And whether it's someone of the team actually in the physician office, or whether it's someone on your team at home, maybe it's a pastor, maybe it's, somebody down the hallway, a friend, somebody, anyone, can kind of help you make those informed decisions.
So again, I think step one, and it sounds easy, but if you are advocating for yourself, is to have somebody come with you. A couple of points. First of all, they can write all this stuff down, and make sure they know what they're supposed to do. When you come here, you're not just going to be a fly on the wall. You're writing stuff down. Here's a pad of paper, or bring a pad of paper. Here's a pen. So you write this stuff down, or you can write it down. They can listen, but just have a strategic plan about, okay, who's going to do what when we get in here. And I think sometimes it's easier. And again, it depends on who your person is. May not be easier for them, but sometimes it's easier for them to ask the more difficult questions. Like, how much is this going to cost me? What is my risk of dying from this? Sometimes it's easier to ask somebody that, that's not you. So if you have questions that you don't want to ask, tell them to ask it. They're not the one sitting in the cancer chair. So that's okay and highly recommended. And again, if you can't have somebody, or even if you can, as long as you tell whoever you're talking to that you're recording, you can record the conversation. My God, our smartphones are fantastic. And I have been in consults where there's been 3 or 4 people on the telephone with we're all in different cities, but we're making a shared decision together. And, the one person's the patient, but we're all helping that person make a decision. It's just amazing. So you can absolutely do that. And most physicians and care team people know how to do a 3-way call on a cell phone now, right? We know how to do that. Absolutely. And it's totally legal and it's totally fine. And again, you can hit the record button. As long as you tell the person that you're recording, they're not going to have a problem. And then you kind of highlighted on this too, is when you get finished, even if, Joe physician has their hand on the doorknob, say, just wait, I need 30 seconds. Can I please repeat back to you what you just said? And then either you can do that, or your person that came with you can do that. You can even ask the question, when I come here, when you and I are talking, if you're talking to your physician, what's a typical length of a visit? Do I get 3 minutes? Do I get 10 minutes? Because that's going to help you prioritize your questions. Like, I
Right.
need to know this before tomorrow. I need to know this to go back to work. I need to know this from whatever.
Right.
And then if there's still 5 more questions, how can I get those answered? Can I put them in the portal? Can I ask your nurse navigator? Can I ask your physician assistant? How do I get that? Because people are, physicians are awesome people. People that work in cancer care are awesome people. We want to answer your questions. Sometimes there just isn't enough time, or the right answers aren't. We just don't know the right answer yet.
Right.
So building that collaborative relationship will be really easy for some people and really difficult for some people, just because
it will.
Their personality or the personality of the person with the badge on that walks in the door. So what are some common challenges that people run into in advocating for themselves?
I think one of the big ones is not feeling comfortable advocating for themselves.
Yes,
having that barrier up, saying, I don't want to be a complainer.
Yep.
I don't want to be the patient who is asking for this. I don't think I can ask this question. I think that's the biggest one, because it's already set you up backwards to being able to try and advocate for yourself, because you're not asking those questions. That's the biggest one.
Yeah.
And then to not have somebody be receptive on the other side to at least hearing you out. I think that's number 2.
Yeah.
Because, and it's not that we're going to agree with you. Not everyone agrees.
Right.
We're all human.
Yep.
We're all going to have our own opinions. We're not always going to agree with you. Just because you ask the question doesn't necessarily mean you're going to get the answer you want.
Right.
But you should at least ask the question and be okay with that answer.
Yep.
Because, say, for example, and a perfect example of this is patients coming in and they're in the middle of treatment, but they need to go on vacation.
Yes.
They need to go on this trip. This trip has been planned for decades. It's a 50th anniversary trip. I have to go on this trip, but it falls smack dab in the middle of my chemo. What do I do?
Yep.
If you don't have the ability to ask that question, how are you going to know that we can work around that if you don't ask? And so I think, knowing what your goals are, knowing what's important to you, but then having the voice to be able to ask that question.
Yeah.
Now, it could be that, hey, if we don't do your treatment on this day, it's going to be a detriment and we don't recommend it. In which case, that's not the answer you're looking for, but you at least know that's my risk if I don't do this treatment on this day.
And that's informed consent.
And it's informed consent.
And shared
it's
decision.
Like, okay, fine.
Yep.
You can go on that trip, but if you don't have the chemo on this day, your risk of your cancer recurring is X. But you've at least asked that question. You've at least heard that information to make that answer or make that decision. If you never ask that question, how are we going to know?
Right. Yeah, and on that vein, there are times you say we can totally put this back 3 or 4 days. We can't put it back 3 or 4 weeks, but we can certainly 3 or 4 days is not going to make a difference 5 years from now.
Correct. But that's the majority of the time.
Yeah.
Honestly, that's the majority of the time, is that this is not time sensitive enough that you can't take this weekend and have your 50th wedding anniversary.
Yeah.
Like, that is not, or if you're doing your chemotherapy and this week of the chemo, you're just toast.
Yeah.
I can't have that week right before this big trip.
Yeah.
Can we change the chemotherapy schedule by a week or 2?
Yeah.
It is not going to delay anything. And this is what I tell patients, is that we have to sometimes delay chemo for blood counts.
Yep.
Your blood counts are too low. I can't give you the chemo. It's not possible. It's unsafe. So what's the difference between not having chemo because your counts are too low and pushing it back a week, and pushing it back a week for a vacation?
Yeah, because you're going to party.
The answer is nothing.
Yeah.
The answer is nothing.
Yeah.
There's no difference.
Yeah.
So if you need in your mind to go on that vacation, we can make that happen the majority of the time.
Yep.
I won't say all the time, but the majority of the time we can make that happen. And how do you know what the risks are and the information to make that informed consent if you don't ask that question?
You don't ask the question. Yep. I think too, when it comes to that, and I don't want people to feel bad, because it's hard to advocate when you are like a kindergartner standing in front of a PhD. It's just like there's can feel like a power dynamic. It can feel like an education difference, especially if you don't know anything about people. Like, I didn't know about this. I'm like, nobody does until you get cancer. Nobody does.
Right. Correct.
Right. And then so there's the knowledge gap. So that can put people in it's a power dynamic can be off a little bit. But I think so. And people say, I don't know what to ask, then I always say, just start with writing down your goals. even if it's for your
exactly.
life. Like, I don't want to have to
Right.
miss work. I don't want to lose my hair. I don't want to, or I don't care what happens. My goal is to make sure I turn over every leaf and every cell, so I can sleep at night, that I've done everything that I
Right.
could. I mean, everybody's goals are different. So even if it's just for one particular appointment, my goal for this appointment is A, B, and C.
Right.
Those, I
Right.
mean, just framing it in that sense, I think, can be very empowering, because then you go in with a
Yes.
purpose. You're like, okay, I got to write these things down because these are the goals that I want, and those goals are certainly going to lead to questions and information that are going to benefit you. You know,
Right.
and even asking the physician, what are your goals? I mean, what are the expected outcomes for this?
Yes.
You know, what's the best case scenario? What's the worst case scenario? Because sometimes they'll throw out, you know, I always do the air quote when it comes to informed consent. Because people say, I don't think I ever heard about this. I'm like, yes, you did, but you were freaked out, panicked, and just, you know, brain dead.
Which is totally normal to not hear half of the informed consent. Completely normal.
I mean, that's the whole informed consent in oncology is really hard, because how can you understand everything in that short of time? Which is why you are hiring good physicians to take care of you that can help you with that. But it is really, really, really hard.
And so keep asking those questions.
Yep.
Or if you get home and you're like, I don't remember a darn thing that she said. So just call.
Yeah.
Just call and say, hey, I don't remember this.
Yeah.
What did you say about
Yeah.
this? Or send a message through the portal.
Yeah.
Or at our next visit, say, hey, you know, I spaced out when you were talking about this.
Yeah.
Can you please re-explain this to me?
Yeah.
I think communication is the thing that a lot of patients, that's the barrier we really have to overcome, is our communication with each other and being able to talk to each other as humans, as, you know, shared people where we are making this decision together. I am not the doctor, you are not the patient. We don't have that power dynamic. We're instead looking at this problem and how do we fix this problem together moving forward, not trying to battle each other.
Right.
But if we don't communicate, then how am I supposed to know how you're feeling?
Yeah. I often feel that, you know, when I am in a situation where, like, if I go to the mechanic, it's like, I don't know what I can't make an informed decision on this stuff because I have no idea what you're talking about. And it's frustrating. Even sometimes going to the dentist, I'm like, he's like, well, you can do this or you can do this. I'm like, I don't know. You know, then you can ask risk and benefits, and it is just really hard. But asking the questions, understanding as best you can, is the best way through that. And you're never going to make your physician mad at you. They're never going to dump you. They're not going to leave you. I often remind patients too, and the data is pretty clear on this, that if you look at the 1 through 5 rating of some physicians, you know, some will get 3, some will get 1s, some will get all 5s, you know, as far as how good they are at bedside manner and stuff. The variability on that between physician to physician is huge. But
it's huge,
right? But when you look at the outcomes, like, okay, if they have 100 people and after 10 years, how many of those people are still alive? They're all about the same, right? So it's not about, okay, I flew from LA to New York and my flight was successful because when I got on the plane in LA, I got off in New York. Therefore, my flight was successful. But in between, you know, the flight attendant was crabby. Somebody spilled, you know, their beer on me. The flight was incredibly bumpy. It was hot. I mean, versus I sat in first class and I got, you know, so the experience can be so different. But, you know, what does success look like to you? You know, and how do you define that? And how does your practitioner, you know, define that?
And we have some patients who don't give a hoot about your bedside manner. If you can tell me that you're going to take my cancer away, I don't care. Just come in here, do what you're supposed to do, get my cancer to go away. It does not matter. And we have some patients where that's all that matters is how they're talked to. And so it's all about goals and what your goals are.
Yep, that's perfect. Can you share an example with us from your practice about maybe a successful patient advocacy story that you know of that may have made a difference for them and what their strategies were?
So it kind of comes back to the vacation thing. So I had a patient who had a very large pelvic mass and it was kind of pushing on all her organs and things like that. And she had these 2 trips planned. And with the fact that it was pushing on organs, it was pushing on blood vessels, it was pushing on things. Obviously, as a doc, we get nervous that this is going to cause problems, right? And so we're like, you need to do this surgery. These are our risks of doing surgery now or waiting until after these trips. You know, we're worried that this could cause you harm. either with your bowel, your bladder, with your blood vessels. You could have a blood clot, like going through all of these risks. But doing these trips were very important to her,
Mm-hmm.
extremely important to her. So she knew about the risks. We wrote them down. We talked about them several times, and she did the trips anyway, because that's what she was focused on. What was her goal going to be is to do these trips with with her family members. And she had the surgery. None of the risks happened to her.
Yep.
Everything turned out just fine. And she was also able to go on those trips.
Nice.
So even though we're gloom and doom about what could potentially happen,
yeah,
it was the right thing for her.
Yeah.
She didn't have any of those problems, and she was able to do what she wanted, which was go on these trips with her family members and then have her surgery. And everything was just fine.
Yep.
So I think that's the thing to kind of hang your hat on, is if you know all the risks and we tell you all that, at the end of the day, the person who has to be okay with your decision is you.
Yep.
It's not me.
Yep.
It's you.
Yeah.
And if you're okay with your decision, knowing the risks, granted, it could have been very different for this patient. She could have had a complication. Right. She could have had a blood clot. She could have had all that stuff. But if you're okay with that, knowing that you went on these trips, which was what was important to you at the time, then that's, at the end of the day, what's going to make you be able to sleep at night, is that you made that decision for you. Not for anybody else, for you.
Yep. Yep. And I think a nice thing to share too at the beginning of your partnership with a physician is, what is your risk tolerance? Right. You know, some people are like, hey, I don't care if there's a 50% chance I'm going to blow a vessel, I'm going. And other people are like, no, if there's a 1% chance,
yes.
I'm not going, I'm not doing it. So everybody, again, everybody's so individual. Your risk tolerance is individual.
Yes,
and that's going to play a part in shared decision-making and informed consent, and how you base your choices off of what you're offered. So,
right.
And you know, some people like, just tell me what to do.
Right.
Other people are like, and I'll do it. Just tell me what to do. I don't want to think about it. Just tell me what to do.
Yeah.
Exactly. That's not wrong. That's just, okay. Again, you got to put your faith in your team.
Your way.
Exactly. And then there's other people that just say, okay, you give me my 3 choices and I will get back to you in a week.
Right. Exactly. And that's okay.
That's okay.
That's okay. You know, but you have to drive your train.
Yeah.
This is your train.
Yes,
you have to drive your train.
Yeah.
Yes.
Yeah. That's awesome. That's awesome.
Toot, toot.
Yep. Well, hey, I always love driving on the Dr. Dickson train, because you are just the best. So thank you so much. You. I think this is going to be helpful either for, current health issues or for health issues in the future. Again, thank you, Dr. Dickson, for joining us on the Recovery Room podcast.
Welcome. Thank you so much for having me. Thank you.
Ladies and gentlemen, put in the comment section, did you feel like you understood informed consent or shared decision-making when you went through cancer treatment? Or are you feeling that now as you go through treatment? Would love to hear your thoughts in the comment section below. Thanks for joining us. We'll talk soon. Bye.
Bye-bye. Thank you.
I absolutely love having you in my listener community, so please follow and subscribe to the Recovery Room on YouTube and Facebook, and to the Recovery Room podcast. Please continue to share these wonderful free resources with your support groups, family, friends, and of course, your medical teams. I also have an incredible cancer survivor community membership group called Recovery Room Plus. I'd love for you to consider joining. In Recovery Room Plus, you get direct interaction with me, in-depth cancer recovery info and experts, and really cool live events like yoga, book discussions, cooking demos, member meets, and much more. I would love to connect with you. You can learn more at recoveryroomplus.com. The link is in the show notes. For this episode recap, one of the biggest challenges or barriers in people advocating for themselves is just them not feeling comfortable advocating for themselves. Communication with your physician and medical team is the biggest tool in advocating for yourself. Remember, you have hired them to take care of you because they know stuff you don't know. Yet you should still feel you can understand the general premise of what is going on. So if you don't understand, it is okay to ask for clarification or repetition. Talk with your physician not just about their treatment goals for you, but also about shared decision-making, your goals, and your risk tolerance. When partnering with a physician in your care, asking questions is always okay. If you feel like they are not being answered, say so and ask who and when they can be addressed, if not currently. Advocating for yourself also includes bringing someone with you or connecting live by phone and giving them something specific to do during your visit. At the end of each visit, either you or your person should read back the bullet points of info you heard or learned. Having a health crisis can be scary, and navigating the health system can be scary and unfamiliar. I hope this episode gave you a bit of a framework to boost your self-advocacy skills and confidence. Thank you again for tuning in to the Recovery Room podcast. It was a pleasure to have you here. Let's talk again soon.